Welcome to the Brain People Podcast, a show where four mental health experts team up to bring you practical tools for overcoming mental health challenges. The Brain People don't replace your doctor or therapist, but we will give you some extra tools to help you on your journey. So join us as we fight mental illness, one episode at a time. Welcome to the Brain People Podcast. I'm your host, Dr. Daniel Binus, and I'm a psychiatrist, and I'm joined today by my co-host, Jonathan Edens, who is a psychiatric PA. And today we have a fantastic topic. We're going to be talking about antidepressants, and we're going to be talking about 5 reasons you should consider taking an antidepressant and 5 reasons you may not want to take an antidepressant. So stay tuned in, and we're going to have some good information for all of our listeners. So why don't we go ahead and get rolling and talk about our definition of an antidepressant. So Jonathan, can you talk to us about that? What is an antidepressant?
Yeah, absolutely. From sort of a technical sense, as it relates to psychiatry, we typically just say an antidepressant is something that's used to treat depression. So nothing surprising, I think, to any of our listeners. I think maybe one thing that might be a little bit interesting, especially if you haven't taken antidepressants before, is just the how useful they are for a wide variety of different mental health disorders. Do you want to touch on that a little bit for us?
Yeah, we often say antidepressants, but in reality, we use them for anxiety and even for non-mental health reasons. Medications like Cymbalta, for example, are used for neuropathic pain. Amitriptyline or Elavil, which it was the popular brand name, also used for pain and migraine headaches and that sort of thing. And so these class of medications, even though they're typically called antidepressants, are used for a wide variety of things, not just for depression.
Let's do a little bit of a brief history on antidepressants. So pop quiz, and everybody's going to judge you, Dr. Binus, in terms of how good of a psychiatrist you are. But do you remember what the first antidepressant was?
Well, the first antidepressant actually was used for tuberculosis, and it was called
Iproniazid.
See, I can't even say that.
That's okay. So its sort of cousin, isoniazid, yes, was used very successfully for the treatment of tuberculosis. So they tried to come up with a new version and call it iproniazid. However, it caused a lot of toxicity in the liver, but when they were using it in the treatment for tuberculosis, they found that a lot of their patients got euphoric. They had a lot of psychostimulation. They had increased appetite and improved sleep. So this got them thinking, it's not a great tuberculosis drug, but maybe we can use it for something else. And so the following year, and this was, I believe, in 1958, they ended up doing sort of the first study with medication for the treatment of depression. And in that study, it was found to be pretty effective. I think something like 70% of patients had a significant reduction. So pretty interesting how things come about. And that's sort of a reality of science. A lot of times, what we discover is not the original reason for, what we were trying to do with it. Sometimes it's just, in this case, the side effect was actually euphoria, and ended up resulting in, the mass number of medications now that are used for antidepressants.
That's right. It kind of even reminds me of the antipsychotic story too, where, they didn't think about antipsychotics for psychosis, but then as they were using it, those sorts of dopamine blocking agents for other things, they found like, oh, this actually seems to calm people and reduce their psychotic symptoms. And therefore we're going to start using it for this. So you're right. A lot of medications are actually accidentally stumbled upon and then used for other things. What's interesting, of course, is that we don't use those particular drugs anymore, the original ones that they used for tuberculosis, for depression. And the reason for that is, of course, the side effect profile. But then what came on the scene next was now it's your turn for the pop quiz, Jonathan, since you put me on the spot. Maybe you'll do better than me.
Well, the MAOIs and the TCAs, right? Those were kind of the first classes of medications. I think imipramine came out first of the TCAs. And so that was also back in the 50s. And then I don't think there's anything in between that. I'm not sure if the atypicals or the SSRIs were next, but I want to say Prozac was like the 80s. Is that correct?
Yeah, the late 80s
Okay.
actually is when the SSRIs came in. So you did your homework. Good job. So the TCAs came on the scene, which are the tricyclic antidepressants. So probably the most famous one I would say is probably Elavil. And that's because that's actually, when you look at the pooled data, that's the most effective one, and it's been used forever. And then other ones would include like nortriptyline, the imipramine, um, prototriptyline, and others. These are ones that we actually don't use a lot anymore. We do use them for specific things. For example, like doxepin, we often use for sleep still. But because of their side effect profile, they've largely fallen out of favor. But there are certain instances where we'll consider them, whether it's for sleep or pain or headaches, etc. So then really in the 80s is where you had the advent of Prozac. That was kind of the big initial one. And we actually still use a lot of Prozac. And then Zoloft and Celexa and Paxil and all these big name SSRIs, which are more selective and they don't have as much side effects.
Let's talk a little bit about how we're not going to get too chemical. We're not going to, teach you all about neurochemistry here, but let's talk a little bit about how these antidepressants work. Can we go through that
Yeah,
briefly?
I think it would be really helpful. I mean, generally speaking, the majority of the antidepressants, and especially the newer generation ones, the SSRIs and then the SNRIs, what they do is they actually block the reuptake. They're called SSRI, stands for selective serotonin reuptake inhibitor. So what it does is it actually blocks the reuptake of serotonin into the nerve cell. So essentially, there's more serotonin available between the nerve cells, which then causes more serotonin stimulation, and the serotonin stimulation lasts longer. And the same is true when we talk about the norepinephrine reuptake inhibitors, except for instead of serotonin, we're talking about the neurotransmitter, the chemical messenger norepinephrine. And so then these medications block the reuptake of norepinephrine back into the nerve cell. And so essentially what happens is if you have more serotonin available in the synaptic cleft, which is the space between the nerve cells, or more norepinephrine available in between those nerve cells, is that you're getting more stimulation of those nerve cells and essentially that neural pathway. And the reason, so then the idea back in the 1980s and even into the 1990s was what we call the monoamine hypothesis of depression. In other words, oh, if you're depressed, it must mean you're deficient in serotonin or maybe norepinephrine or maybe dopamine. And if we can just increase the levels of serotonin, norepinephrine, and dopamine, then you're not going to be depressed anymore. Now, maybe you can comment whether that's completely panned out or not.
Not exactly. Luckily we've sort of moved on from that hypothesis. It's still obviously extremely prevalent, given the fact that most of our medications, pretty much all of our medications, focus on those three neurotransmitters. However, as we'll get into today in a little bit, now we're sort of taking a more, I shouldn't say everybody, but at least we are here at Beautiful Minds, taking a more comprehensive approach, because we recognize that there are things such as your inflammation status and methylation, things such as other dietary changes and micronutrients that can play also an incredibly impactful role. And it's simply not just about those three neurotransmitters. So let's moving on, and let's just have
If you don't mind, I'll just interrupt real
sure.
quick to really affirm what you're saying, because the point that we have to understand with mental health and with our physical health for that matter is that it is actually a very complex picture. And like you said, it's like, okay, there's some aspects there of involvement with maybe elevations or not having enough of certain neurotransmitters, but that's also, there's reasons even for that, right? And that can have to do with nutritional status. It can have to do with, like you said, inflammation. And it really ends up being more about how active certain neural circuits are and the reasons for that. And so, the picture is actually a lot more complex. It's not quite as simple, but that's why the medications can help, because they can kind of correct part of that picture and maybe mask some of the underlying reasons for the dysfunction, but in the end, they don't necessarily take care of the underlying problem.
Yeah, absolutely. We're going to do a just brief disclaimer. This is not what the next sections that we're going to be talking about. It's not individual medical advice. Please talk with your personal mental health prescriber before making a medical decision. For some of you listening, that may be myself or Dr. Binus, so you can obviously talk with us, but just keep those things in mind. Okay. So let's go through the 5 top reasons to take an antidepressant. Now, we just want to say up front, we're not either for medication or anti-medication. We're for what's best for you as an individual. So let's talk about the first reason that you should take an antidepressant.
Yeah, so it really is important for us to understand there is a time and a place for people to take medication. And it's important, like you said, Jonathan, not to just like demonize medications. But of course, we want to do things as holistically as possible. But one of the reasons I think is that, obviously there are side effects. But if you really feel like, man, I know there's side effects, but I'm really struggling so much and I really need some help and I think the potential benefits outweigh the risks, then I think that might be a reasonable reason to actually go ahead and try something because you're saying, yeah, I understand there's risks of side effects and there's problems with that, but my depression is just impairing my life so bad that I need something to kind of get me jump started here.
So there are, I mean, let's talk a little bit about some of the side effects because for at least for people that haven't been on them before, and they're kind of considering, is this the right time for me to take one? And what should I really be looking out for, both in the short term and the long term, if I'm eventually going to stay on it? So can we talk about some of the most common, maybe short term side effects?
Yeah. So in general, when I prescribe an antidepressant, I'm going to be telling people, look, most people or a lot of people, especially if you start at the dose too high, then you can get some real GI side effects. In other words, nausea, diarrhea, that sort of thing. Now, fortunately for almost everybody, those side effects are very limited and they go away within days. And typically, if you know how to prescribe them and the person's not abnormally sensitive and you start nice and low, it's usually handled pretty well, tolerated pretty well by people. So that's not usually too big of a deal. Um, One of the most common side effects, though, that actually a lot of people just don't talk about because it's kind of embarrassing is sexual side effects.
Yeah.
And the sexual side effects hit actually the majority of people, at least on some level. And that can, include decreased desire for sex, not achieving orgasm, et cetera. And so that really can impair people's quality of life. And there's actually a good majority of people that end up going off of antidepressants specifically just for that reason.
Sure.
And then, there's other side effects. Of course, there's the black box warning that we have to consider when we talk about.
Before we
Yeah,
talk
go
about
ahead.
though, I do want to say one thing about the sexual dysfunction. I've
Mhm.
actually used it in certain patients very strategically. So I'm guessing you can probably imagine what I'm getting at. But I've had some individuals, particularly men, that say had an issue with pornography or masturbation, and it was causing a lot of rift in their marriage. And because they weren't sexually active anyways, they actually found that to be extremely helpful in reducing the desire, while simultaneously improving their mood and their motivation and stuff like that. So, sometimes a side effect may actually be a good thing when used in certain situations.
That's true. I've had that experience as well, and certain patients have actually asked me and said, "I know that these cause sexual dysfunction, and I need that right now because I'm really struggling in this area." So that's actually a really good point. So yeah, to the black box warning. So basically, when there's a serious side effect that can potentially be fatal or very harmful, then the FDA will often issue a black box warning on certain medications, and so they have done that on the antidepressants, meaning the reason that they put a black box warning is because there is some data that has come out that said that there's an increased risk of suicidality, especially with young people when they're first starting off on the serotonin medications, and so basically what some of the studies have shown is that earlier on in treatment, and meaning the first few days and first several weeks, there is a slightly elevated risk of actually attempting suicide. And so that obviously is very dangerous, and it needs to be discussed, especially with the young people that are starting antidepressants.
So just to be clear, there are we want to make sure that people understand that there are differences between different types of risks. So a lot of times when we talk about increased risk, we're maybe talking about like relative risk versus absolute risk. And so while the relative risk is definitely higher, particularly in younger individuals, the absolute risk, which is the total risk, is still relatively low. And so it's not necessarily, and this is where it gets really tricky, because we can't give individual medical advice. You have to talk with your doctor, because there have been definitely cases where the potential pros, outweigh the cons, even in those younger individuals.
That's right. And so the main thing is that when I prescribed antidepressants to young people, I've let them know about that risk, and we've had that conversation. Like, look, it's possible that you could have stronger thoughts, and for some, it's actually that they've already had the thoughts, but then the antidepressant actually gives them the energy, because it kind of gives them this boost, and it kind of also triggers more activity in the emotional part of your brain, and their frontal lobe, which is the part of the brain that actually helps them with self-control, is still not working well because they're so depressed. And so then it can cause this impulsive suicide attempt. And so we have that discussion, and we don't get in too much detail, but we basically say, look, it's possible you could get more suicidal. It's really important that you speak up and you let someone know. And then, if I have a pretty good sense that, yes, they understand that, and that they're going to speak up, and also their parents know what to watch for, then, and obviously they need it and they're really struggling, then it's like, yeah, okay, we're going to consider that.
I would add one more sort of long-term, relatively serious side effect that I have a lot of people complain about when they're on these medications, and that would be like emotional flattening or numbing. A lot of times this is sort of a dose-dependent response. You take too much, and some people get so flat that they don't really feel like they have a whole lot of emotions, even when the context of the situation warrants, having emotions. For example, somebody dies in their family and they can't get themselves to cry, and that can be really disturbing to people.
Absolutely. Yeah. And a lot of people actually really do want to lower their meds, at least so they can feel. And they say, okay, I'm not depressed, but I'm not really happy. I'm not really joyful, and I'm not sad either, but I just feel kind of almost robotic. And so that can bother them. And so there can be, not for everybody, but I have heard that as a common complaint.
So for the number two reason not to take, to take an antidepressant would be that you've tried a lot of non-medication approaches, and those were not sufficiently effective to you. What I tell a lot of my patients is that I focus on sort of three big puzzle pieces in terms of overall treatment. And so, there's medications, there's supplements, that would be kind of one piece of the pie. And then there's psychotherapy, which is another big piece of the pie. And then there's lifestyle interventions, right? So a lot of people by the time they're getting to me, they've lived a healthy life. They've done all the lifestyle stuff. They've seen a therapist maybe multiple times. There's some argument as to whether or not it was a good therapist, but in a lot of cases, they've tried those things. They haven't been adequately sufficient for them. And so they're ready to try an antidepressant because that's kind of what's left.
Yeah. And that makes a lot of sense. If people really have given it a good try with these other modalities, then sometimes that antidepressant can actually help them get over that hump.
And if you are in that camp, trying the antidepressant does not mean that you should stop the other things.
That's true. That's true. And also, I think it's important for people to understand that trying an antidepressant doesn't mean that you need to take an antidepressant for the rest of your life. Now, the problem is if you're not dealing with a holistic prescriber who really understands how to help you get off of an antidepressant, and how the other things that you're doing lifestyle wise, psychotherapy wise, et cetera, can help in that process, then it's easier for most prescribers, because they're super busy and all that, just to say, hey, you're doing pretty good, let's just keep you on it. So it is important for you as an individual, and also to work with a prescriber that is really wanting to be intentional if you're interested in getting off medication long term.
So number three, and this this will only require just a little bit of explanation, but essentially, one reason you might want to consider taking an antidepressant, or I should say a couple reasons, would be you're financially constrained in the fact that maybe you don't have a whole lot of money to invest in some of these more expensive alternative approaches. You're physically limited, so you can't really do a whole lot of exercise. You know, I've had patients come in where they're bedridden, and so it's getting them to do exercise is nearly impossible, or they don't have good access to quality therapy in their area. I know, especially in certain rural parts of the country, getting a therapist can be extremely difficult. Now, that's more easily overcome nowadays with virtual therapy, but it's still a lot of those don't take insurance, and so it can still be pretty expensive.
Yeah, absolutely. And so it is important to kind of see your limitations and then respect those, and then make a decision. The fourth reason is your symptoms are moderate to severe, and they are causing significant impairment in your day-to-day functioning. And I think that's an important point, because oftentimes mild and even moderate depressive disorders and other mental health disorders can be pretty well managed through lifestyle and therapy. But once you get more towards the severe end of the spectrum, oftentimes medication can be really helpful, at least as a bridge to help people get through the worst of it. And then oftentimes, when people are through the worst of it, what I've seen at least is that if they're doing those other things that we're talking about, like the therapy and the lifestyle and the spiritual connection and relational growth and all of that, then they can actually get off of medication. Now, that might not be everybody, but many people, if they use that holistic picture. But the mistake I think some people make is that they're almost so holistic minded and anti-medication that they wait until it's
Mhm.
really so bad that even the medication it can be difficult for the medication to work. So you don't want to wait until you're to the severe to that point. But there's kind of a fine line sometimes, I think.
There are two sort of, I guess, individuals that, or I should say, with severe depression or qualifications that would give them a diagnosis of severe depression. That in general, I'm going to always sort of highly recommend starting a medication, because it's in these cases we have to take a little bit more of a all hands on deck approach. And at least for me, those are going to be patients with suicidal intent or urges, right? If we can get them to the hospital, we're probably going to do that. Otherwise, if they've got really well supportive family, then we're probably going to start them on a medication if they haven't been. And then the other one would be major depression with psychosis.
Yeah.
So these are going to be far more severe cases. Usually, they might have these hallucinations that are telling them to do certain things, that can be very convincing. And so that's kind of another concerning case.
Absolutely. I fully agree with that. So what's our last one?
You need faster results. So maybe we can explain this one in a little bit. I'm not to say that. So a reason to take an antidepressant would be that for whatever reason you just need those results very quickly. Reason we say that is because, at least relatively speaking to the antidepressants, a lot of these more lifestyle interventions are going to take a little bit more time for those things to reach sort of a full effect. So specifically like diet, diet can definitely have a positive improvement relatively quickly, but at least in terms of a lot of the studies that we've seen, that and exercise, these things tend to overall they tend to catch up with the effectiveness of the antidepressant over time, and in a lot of cases become more effective than the antidepressant the longer that you do those things. And then also psychotherapy. This also does kind of depend on the quality of the psychotherapy, but in a lot of cases, we're looking at maybe 6 weeks to reach maximum effect for an antidepressant, whereas with psychotherapy, it might take you a couple months to get in, and then, it takes a couple sessions to get the ball rolling. And so you might be looking at more like a few months before you're seeing some pretty significant results.
That's right. And I think that speaks again to the idea that oftentimes these different modalities can actually work synergistically. And as you then start engaging in some of these other things like exercise, nutrition, therapy, et cetera, that can be helpful as well. But those ones can actually be more enduring, then you can start to wean off antidepressants. So we've touched on 5 reasons that we should consider taking an antidepressant. Let's talk about some reasons why we should not take an antidepressant.
So the first reason would be you've tried them before and they weren't very effective for you. So why do we say that, Dr. Binus?
Well, one of the reasons we say that is, a lot of people will take an antidepressant and then it'll be not very effective, and then they'll say, okay, well, take another one, and you go back to your doctor and you're like, okay, this one didn't work, and then you just keep trying and trying. Pretty soon you start feeling like you're hitting your head into the wall, and it gets really frustrating. And in fact, there's actually studies that show that the more antidepressants that you've tried, the less likely they are going to be effective. In other words, when they did the largest study on antidepressants ever conducted, the STAR-D trial, they found that for the first antidepressant, about 27% of people actually went into remission. So that means that the antidepressant helped enough that, they were no longer depressed. But then if that one didn't work, then they would try a second antidepressant. And what they found is that for people where the first one didn't work and then they tried a second one, the second one was only effective 21% of the time. Okay. Now, for those that didn't respond to the second antidepressant, they would try a third antidepressant in the trial. And for that, then it decreased to 16% effective remission rate. And then if that third one didn't work, then they would try a fourth one. And once you've tried 3 antidepressants and those first 3 didn't work, the likelihood that the fourth one is going to work is only 6.9%. So less than 7%. So what we see is the more antidepressants you've tried without success, the less likely they are to be successful. So literally pretty soon you are hitting your head into the wall. I mean, it's just, you're going nowhere with it.
Yeah, and I think it's extremely telling, not only in the fact that with each subsequent antidepressant that's attempted, it becomes less and less effective, but also, as that study points out, it becomes less and less tolerable as well. They showed that with each subsequent antidepressant, patients had more and more side effects. So as you said, it's not just, the hitting your head against the wall is a perfect analogy because it can be very painful as well, right?
Absolutely. Yeah. And I think we were even talking about this before the podcast, like, well, why are the side effects almost exponentially worse on every one of those levels? And maybe part of it is even just the frustration of like, it's not working. And your body almost develops like this sense of repulsion to taking another antidepressant. And certainly that I don't think that's far fetched, because what we see is placebo, whether, we're thinking about something in a good way or in a bad way, has a huge effect on our ability to respond or our side effects and all of that.
So one thing that's also you can take away from the STAR-D study, especially with that first antidepressant, 27% remission rate, right? So approximately 1 in 4 people would go from having clinical depression to not having clinical depression within like a 6-week period. That doesn't talk about the patients that do respond but don't completely remit. Right. So there's more than that will actually have a positive effect, but it creates a little bit more of a sort of a difficulty to determine whether or not that is worth it.
Yeah, absolutely. One interesting thing too, though, is that, if you look at that, the whole study and all the data, is that at the end of the day, people did respond, they did remit, but then when they followed those people, very few actually maintained their remission as well. So even for those people that remitted, they didn't maintain it long. Most of them, I should say, didn't maintain it long term. And so again, we're not trying to demonize antidepressants, but it's clear to me, both from clinical practice and also from looking at the research, that just taking an antidepressant by itself, it just ain't enough.
Yeah.
We got to do more than that.
It's just one piece of the pie, so to speak.
Exactly.
So reason number 2 not to take an antidepressant, you're very concerned about adverse effects, or you've had significant side effects to one in the past. So we kind of already talked about some of those, right? If say you had, the increased suicidality with one, or you had the sexual dysfunction and that's incredibly important to you, then, this would be something you'd obviously want to consider.
Absolutely. And number 3, you are worried about psychological or physiological dependency. Now that's kind of an interesting one because we don't typically think of antidepressants as being addicting, like maybe some of the other medications that we have, like opiates, we think of that more of it can become obviously a drug of abuse. And we think of Ativan or Valium and some of these benzodiazepines as being typically more of a drug of abuse. We don't think about like people like, oh, taking extra Zoloft or Prozac to get high, right? So that's not really what we're talking about here. What we're actually talking about is that the brain does change when you ingest a foreign substance into your body. The brain actually does go through changes and to kind of try to maintain homeostasis basically. And so when the brain goes through changes, that then causes if you then take that medication away, then you can actually get withdrawal symptoms even if you're not quote unquote addicted or abusing it or something like that.
Essentially, your body gets used to having that there, and all of a sudden, when it doesn't have it there, it needs to sort of readapt.
That's right.
And that phase in which you're trying to get back to a new homeostasis can be very uncomfortable. And sometimes, for some people, withdrawal doesn't happen. Depending on the medication. Some people it's a few days or a couple of weeks, and for other people, like it can be months
Yeah.
that it might take for them to recover. And there's probably an argument that some people don't ever fully recover.
Yeah. In your experience, what have you seen as far as like the ones that seem to be kind of the hardest when we're talking about antidepressants for people to get off of?
Paxil and Effexor.
Yeah, those can be hard. Those can be hard. I've also seen Cymbalta be challenging for some people as well. And I've, a fair amount of people with those withdrawal symptoms, they can get these electric zap like
Mhm.
feeling. I don't know if you've heard
Yeah, yeah.
patients describe that. Like
Yeah.
it's almost like electricity shooting through their brain and that sort of thing. And with Paxil, it can just be a lot of anxiety and just agitation that people can feel. And so, yeah, it can be very difficult for people, but I will say there is hope, but you have to really do it very slowly, ideally under the guidance of a holistic minded practitioner that can help you not only do the lifestyle things, but oftentimes proper supplementation with different supplements and certain foods and whatnot can actually help to mitigate some of those withdrawal effects. But I will say, probably the most important aspect of it all, at least in my experience with the more difficult to withdraw from ones, is to do it very slowly. And I think people try to do it oftentimes way too quickly, especially if you've been on it for a long time. You got to be patient with the process. You really do.
Yeah, but you don't have to feel stuck.
Right.
Like we're saying, if you do it correctly, we can really mitigate the risk of withdrawal, or at least significant symptoms that would make you want to go back. But I know some people, they just don't feel like they've tried maybe by themselves, right? And it's been such a terrible experience that they get in this position where they feel like I'm stuck, right? I can't get off of this medication. I'm going to be stuck on it for the rest of my life. Let's talk a little bit about psychological dependency, because I think that's another really important aspect of this. And this goes a little bit back into that feeling trapped or stuck on the medication. But for some people also, it's, maybe they did get some initial benefit from the medication when they first took it, or at least they believe that they did. And not to say that, it couldn't have happened. That's not what I'm trying to suggest. Of course, a lot of people benefit from these medications, but because of that emotional and mental safety net that they originally got, they feel like they feel like they can't go without it.
Mm-hmm.
Right. And so without the medication in their system, then they just feel like they're going to revert back to where they were or worse. And, our hope is always that we can, even if you're taking medication, that we can encourage you to get better in other avenues, which we'll talk about here in a second. And so therefore the need of the medication reduces over time.
Absolutely. And I think, to really help get over that psychological hump, it's important to have a sense of like, I can do this, like a belief, like, no, it's possible for me to do this without medication. And also a support system in place too, like a sense of like, okay, I have a support team here from maybe a mental health provider or family or someone. I'm not in this alone. If something happens, I have kind of a backup and I'm not just going to be like up a creek without a paddle kind of experience. One other thing I wanted to mention about the physiological dependency is that there are some studies that show that there are, definitely brain changes that occur with changes in serotonin receptor availability, and and also even some studies that show that maybe the amount of serotonin nerve cells themselves might even go down. And so that's again one of the concerns that people have in the long run of being on these medications. Are these changes permanent? And I don't know where that threshold is. I think it probably differs from person to person, but I will say that I think the ideal, and I know life is often less than ideal, but if someone, people often ask me, well, how long can I kind of safely stay on this medication without potentially causing um, more permanent changes in my brain that are more difficult to reverse? And I usually would shoot for 6 to 12 months. Now, that being said, there are situations where, because of the severity of someone's mental illness, they do need to stay on it longer than that. So I'm not trying to say everyone can get off, but in an ideal scenario, to prevent those long-term brain changes and to make it more easy for your brain to maybe bounce back to its pre-medication state as far as like serotonin nerve cells and receptors and all that, probably just 6 to 12 month windows, something to consider.
For number four reason, or the number four reason to not take an antidepressant is that your symptoms are mild or mild to moderate. And one thing I do want to say about this is you may believe that your symptoms are mild, but really you should make that decision with a mental health professional. I've had tons of patients come in who either over-report or under-report, and really when we kind of dive into their situation, it turns out that when they filled out the screening or when they kind of reported to me, it was really they were only there because maybe other people thought they should be there, but actually diving into it, it was like, whoa, you're actually dealing with a very severe case of depression. And but in general, if you and a healthcare practitioner can come to that agreement that, hey, these symptoms are relatively mild, then a medication may not be the right fit for you.
Yeah. And there's so much we can do and so much we're learning about holistic treatments that oftentimes for those mild and even moderate cases, we can get really good results. And, I'll even go as far as to say there are at times even severe cases that I've seen turn around without medication, but we just have to be a lot more choosy with how we're going to deal with those situations, a lot more careful. And especially for the more moderate to severe cases, it's so important for a really good mental health professional prescriber to be involved, to really oversee, to watch for those danger areas so that things don't head south.
One thing I will say also is just with antidepressants, they actually tend to be also more effective the more severe it is. Now, part of that may simply be that there's more room that you can actually change, right? But in general, the research has shown that the benefit we get from patients with more mild to moderate symptoms tends to be less significant in those cases. So that's just sort of another nail in the coffin, I guess,
Yeah.
for those individuals.
And that's probably why we've also seen in some of the research trials on antidepressants is that some of the research trials actually don't separate from placebo.
Hmm.
And part of that is probably because they're looking, also at the milder and moderate depressive uh, individuals. And so, it just goes to show that it's not a one size fits all approach.
So what is number five,
So
Dr. Binus?
number five, you have not tried non-medication treatments, and we've been alluding to this and really talking about this throughout this podcast episode. But basically, if you haven't tried holistic approaches, you really should, because there's so much we can do to treat our mental health and get us back on track, even without medication. So, Jonathan, maybe you want to touch on a few of those things?
Yeah, I've talked about the lifestyle interventions and what I call the core four before in a previous podcast, but essentially that's diet, exercise, sleep, and sleep hygiene, and social activity, right? Social engagement. So, we've gone into those specific things in detail in other podcasts. So we're not going to do that here today, but just know that those are incredibly important for not only just mental health, but general health, as well as, it can permeate into so many different aspects of your life.
Absolutely. Yeah. And those four, are very, very important. And I would probably add, maybe we can have our super six because
like
you
it.
got your core of four. Let's try our super six. So I would add two that I think are very important too. And one is the psychological, the cognitive therapy. Cognitive behavioral therapy has been shown time and time again to be effective, the most effective psychotherapy for all sorts of mental health disorders. And depression, anxiety, are no exception. And the results of psychotherapy, specifically CBT, cognitive behavioral therapy, are more enduring than medication. And so I think it's a must-have to really delve into some psychotherapy. And you don't necessarily need to even always do it with the therapist. I mean, there's a lot of great cognitive behavioral therapy books, self-help books that are wonderful. And then the other thing that I wanted to point out that is very helpful for patients and for people in general, and the research, there's actually very robust literature on this, is that healthy spirituality can be very helpful. And so, to me, that kind of does fit under that relational umbrella that you're talking about, the social, but
Mhm.
also, the spiritual can be tremendously helpful, because that's where you can take a lot of these existential concerns to, take it to God and say, what do I do with stuff outside of my control, for example? Where do I get strength to overcome things when I don't have that strength within me? And so there's a lot to be said for a healthy spiritual experience, which, by the way, I want to remind our listeners there's a huge difference between healthy spirituality and unhealthy spirituality. And that's something that, we're going to talk about more in subsequent podcasts. But a truly healthy spirituality can go a long ways in helping people's mental health. So we can see that obviously there are a lot of good reasons to consider taking antidepressants, but there's also a lot of good reasons to consider not taking an antidepressant. And so this is not an easy decision. I want to encourage our listeners to really think through this make this a very thoughtful process, one that you don't necessarily try to do on your own, that you try to do it with a mental health professional who is holistic minded. And if you can get some family support or involvement in making this decision, that can be very helpful as well. And always remember, even if you do take an antidepressant, there are so many other things that can complement that and make the outcome so much better, especially in the long term.
Thanks for listening. To hear more episodes, find us on social media, or support us financially, visit thebrainpeoplepodcast.com.